My name is Jason and I'm the owner of Prime-Physio Fitness. I started Prime-Physio Fitness as a way to integrate physical therapy principles into the fitness world and provide a better understanding of movement so people could have more effective training and reduce the risk of injury. After years of working as a trainer and working out myself, I was always looking for ways to improve my assessment skills when working with clients and improve the quality of my own training as well. This is how I came to develop the Lifting Assessment Guide. In this guide, you will learn how to systematically assess the squat, the deadlift, the overhead press, and the bench press, which are fundamental exercises for any training program. I start by breaking down the mobility needs at each joint that is needed to safely and effectively perform each exercise. Then we perform a mobility assessment and implement an exercise-based strategy to improve mobility if we find a limitation. Once mobility is clear, we focus on motor control drills. These drills are aimed at improving the way that your muscles fire so you can perform the exercises in a smooth, coordinated fashion. As a fitness athlete or CrossFitter, you will be able to assess your mobility for the exercises and implement strategies to improve your mobility or motor control when necessary so you can safely execute the lifts and maximize your training results. As a trainer or coach, you will sharpen your assessment skills that will transfer over to working with your clients or your athletes so you can target their specific mobility or motor control limitations. Most importantly, the assessment results will allow you to select specific, exercise-based intervention strategies to target your own mobility needs or the needs of your clients or your athletes. This eliminates the guessing game of arbitrarily selecting mobility drills just because we think it needs to be included in the warm-up. This saves you time and effort so you can stop guessing which mobility drills you need to use. Mobility work has its place, but it needs to be specific to the person whose mobility you are trying to improve. This guide will help you improve your assessment skills, keep mobility work specific to the person who is performing it, and understand your why for selecting exercise-based interventions to improve your mobility work and the quality of your training.